of risk factors. There are certain risk factors that we know now that puts one person at a higher risk of getting cancer than someone else. So those are things like African American descent, just as Dr. Lewis mentioned, strong family history of prostate cancer, the first degree relative, and also certain genetic mutations. Right. So when I see patients in clinic and try to screen them, for potentially having prostate cancer, I do ask them about their mother's history as well, not just their father's. So if mother has a breast cancer and there's a strong history of breast cancer with a sister and aunt, then I ask them, have you ever had your DNA shown for potentially having certain mutations like the BRCA2 gene, which is known to be a strong gene that's associated with breast cancer. And now we know that certain genes like the BRCA gene can put you at a higher risk of getting prostate cancer as well. So, to kind of summarize, strong family history, certain ethnicities, and also having certain DNA mutations can put you at a higher risk of getting prostate cancer.
Okay, so know your risks, definitely.
And to follow up on him, I have a family here from Edinburg the father was diagnosed at 53 with prostate cancer. And he had 3 sons and a daughter. The daughter is a family practice physician. And doing her research, she said, hey, you guys need to check. Well, the oldest sons were diagnosed with prostate cancer in the mid to late 40s.
Wow.
The third son, who came to see me, normal PSA, normal exam, and I said, well, with your history, you probably have prostate cancer already. And I checked with some of my colleagues, I did a biopsy on him, and he had significantly, clinically, what we call clinically significant prostate cancer. He was 38 years old. So in those with a family history, and with the genetics, it tends to be very aggressive, detected at that early age. But it can be very powerful for you if you have a family history. There is all the more reason to check, and that starts at around age 40.
Okay, thank you.